Hello there. This is Zena from Hamilton Facts, FACTS, Facilitation, Agile Coaching, and Transformational Services. I'm here today with Therese Rodriguez, who is a board-certified nurse and a facility care specialist, sometimes known as a practitioner. And she has more than 25 years of service with fertility care. And today we're here to just educate everyone on the services that she provides. And Therese is normally a person that likes to educate people on fertility care, and in particular couples that are struggling with fertility care. So let's get right to it.
What a beautiful question. The clients that come to me, okay, let's see, we've got clients are between age 25 and 45, I'd say. The younger ones are often looking to avoid pregnancy. So we're just tracking so they can figure out what's that time to avoid being together, sexually speaking. And then maybe the women who are single at that age, they're really coming to me because they have horrible life, like crippling PMS, or they know they have a diagnosis of endometriosis, or they have the history in their family, PCOS, and that's polycystic ovarian syndrome. And then the couples who are coming, who are looking to achieve pregnancy, often they already know they don't want to go down the IVF route or the fertility clinic route, and they've heard that there's doctors who can take a natural route first. Some people do come after they've tried and been unsuccessful with IVF, and then they heard, oh, there's a doctor who can go beyond that. And so then those doctors usually refer to me. So the couples come, and that's the couple, and what their needs are is they'd like to get a solution to what's going on. And the tracking, if you think about it, it's kind of like they're going to be looking at almost like an EKG of their fertility. So the tracking doesn't diagnose directly. So I can't diagnose, but I can, with them, find about 15 points of risks associated with women's health that then the doctor can use to diagnose. Like an EKG doesn't diagnose a heart attack, but you can see it on the EKG when it dips down, at a certain point. That they probably had a heart attack, but they got to do a lot more to figure that out. Okay. Well, I'll start like how I teach teens. If you know as a woman that we have a red flow, the period once a cycle, even if it's every 3 months, about 2 weeks later, that red flow, after 2 weeks after that, we'll have a white flow. And that's just cervical fertility sign discharge. That's normal. It's healthy. It doesn't need to be gotten rid of. Sometimes you need to manage it because it might be too much, but they're both about 5 days long. Like the period should be 5 days long, that red flow, and the white flow 2 weeks later, about 5 days long. And that's a normal, healthy, good part of every woman's cycle. So beautiful. The people who come to me are usually referred by a doctor, unless I'm reaching out on Facebook gently, just giving information, and then they'll ask me, can you tell me more about something? So to be clear, I don't go searching people on Facebook. So for both sets of couples, they're very empowered already. They're really supported by each other. They've got an imbued, renewed sense of hope that they've heard that a doctor is going to listen to them and go further than they went before, where otherwise they'd been told sometimes for up to 20 years that this was the end of the road, and either with their health or trying to get pregnant. Like that's it. That's all that medicine can do for you, is often, maybe 90% of the time, what these couples are told. And they still come with a sense of hope. It's an incredible kind of couple and woman who does come to me. And I'm popping it up and lifting it up and hopefully lifting it farther.
Yeah. So the compassion that you have shows in every question that I've asked. And I know that when people come to you, because I've heard of a few people that have come to you. This is one of the reasons why I wanted to do this spotlight on you. They really feel like you care and that you are helping them in the process, educating them in the process, and then also that you care enough that you want to see the baby at the end.
So true. Thank you, Zena. That's it's so true. I'd love that to come through, that I'm going to walk with people in their journey as much as they want and when they want. And wonderful. Thank you. In nursing school, I learned about the body. I learned a little bit about how the women's cycle works, and I was interested. There was a course outside of my nursing program that I took, and I started to track my cycle every day, looking at fertility signs. And then when I got married, we used this method for tracking the fertility to actually avoid pregnancy. So it was a birth control method for many years.
Okay.
And then I became licensed and trained to teach couples how to track their fertility, not just for birth control, but for women's health, for achieving pregnancy, and then really to look at the root causes of just women's health that was going on, different problems that were going on. Like for myself with PMS signs that I thought I would just manage on my own, tell the doctor about, eat well and diet and exercise, and then found out that using this fertility tracking daily, the doctor could actually diagnose and treat an actual condition, which eliminated PMS signs for me. And then I was motivated, since I have 5 daughters, to really learn this method and to teach the whole world.
Wow.
Yeah.
Well, I want to thank you today, and I want to ask you if you can come back one day so we can have further this discussion.
It would be delightful. This was fun.
Now, do you have anything, how can people get in touch with you, and do you have anything coming up?
Okay. Yes, actually, I'm going to be giving a seminar, and I'll do this once a month. So it's going to come at the end of August. It's going to be Tuesdays at 2 p.m. So Tuesdays at 2. And again, in the evening at 7. But if people remember Tuesdays at 2, maybe they'll remember the 7. And they can reach me at Metro DC FertilityCareRN.com, or the same Metro DC FertilityCareRN at Gmail.
Cool.
And I'll leave it at that.
No,
I guess
go
I
ahead.
could give my phone number too, but it's on the website.
Okay. If you want to give that phone number, it's fine. But if you don't, we'll
Oh, no. Yeah, I don't mind. It's on the website there too. 301-512-7451.
Oh, I'm so glad that I had a chance to talk to you. And I know you're helping people every day. And I'm so grateful to be able to know you. So, okay, so let's go ahead and wrap it up right now. And we will go ahead and maybe someday in the future, I'll go ahead and do another interview with you.
Sounds good. I look forward to it, Zena.
Right.
Thank you.
Thank you very much.